Hello everyone, this is Dr. Ankit Goel, your psychiatry faculty at PrepLadder. Now this video is specially made for all the psychiatry residents out there. I hope all of you are doing great in your residency. This video is a quick guide and orientation for your psychiatry residency. Let's discuss what are the important points we are going to cover in this video. First of all, we'll come to straightforward facts of residency. We'll talk about some important points, some important difficulties we face in residency. Then we'll talk about what are the important strategies one can follow when we are passing through the journey of residency. And we'll talk about separately strategy for first year, second year and third year residents. We'll talk about all the important resources which one may use during your residency. Then we'll talk about the PrepLadder Psychiatry Residency app which we have launched. What are the important features of this app and how it can be useful in your residency and how your residency can be made a bit more simple from this app. We'll also talk about various assets including the QBank, notes and treasures which you have in the app. So let's get started. Now let's talk about some simple plain facts of residency. Now, be it psychiatry residency or be it any residency, we know that from your undergraduation to post-graduation in itself is a major transition. It's a total shift, like a color shock you get in Rorschach ink blot test. Of course, not the same, but I hope now you're getting the crux. So there is more responsibility now in your residency. So from the carefree or less responsibility in undergraduation, now there is more responsibility on the shoulders of a resident. Also, in terms of learning becomes more by self-exploration. Self-study takes a lot of precedence and there is minimal or nearly no spoon feeding. So a resident is on their own when it comes to the learning. Also, we know that skills and skill learning takes precedence in your residency. Now, we know psychiatry is a highly clinical oriented branch and we rely very less on investigations, on reports. Rather, it is our interviewing skills, our clinical skills comes to the rescue when we are making any diagnosis. So clinical skills become very important for your residency. Also, residency is a very important phase of learning. Now we learn the basis. We form the concepts in our residency, which subsequently we keep on building in our SRship and subsequently later in our career. But in terms of the base, residency is very important to form important concepts, which will become very useful in the later part of your career. Now let's talk about work-life balance. Now always we talk about work-life balance, but when we talk about residency, this balance may not be that balanced. In fact, in residency, one has to juggle between duties, self-study, there is thesis, there are departmental presentations. So there are a lot of things on the platter with which a resident has to juggle with. So work-life balance, of course, is something which we find more after the residency. But in residency, you have to have a lot of things managed by you. Also in terms of theoretical versus practical. Now it always comes to, whether you should spend more time in theory, more time in practical learning. And again, very important, especially in the initial part of your residency, practical clinical skills become very important. But subsequently, we later on learn that, of course, theory is also very important. So one has to keep a right balance between the two. Coming to whether psychiatry is an easy branch. Now often in our undergraduation, we have this myth that psychiatry is an easy subject, and this can be related to because we have very little exposure in this branch in our undergraduation. But of course, by now in your residency, you would know that it is not a very easy branch. Now sometimes, it can be very tiring both mentally and physically, of course. So as we have a lot of clinical skills which need to be developed, history taking, MSc, and we learn that, initially it appears very difficult, and of course, gradually with time, we get a hold of these skills. Now, in terms of patient handling a patient with the psychiatric symptoms can be very different from handling a patient with medical or surgical illnesses. And sometimes we get involved with the patient. We keep thinking about the case even when we are off duty. So, we get emotionally involved in the case at times. At times, our patience is tested. At times, we become judgmental. But of course, we learn how to handle all these situations, all these cases with time. But of course, it can be mentally tiring. Now, coming to syllabus. Now, again, we see that in psychiatry, as compared to some of the other subjects, the syllabus is too vast. We have so many things to read, a lot of books, a lot of resources are available, and reading is a very, very important part of residency. Now, also in terms of resources, there are too many resources, too many books, too many articles, and sometimes we are just stuck that from where to start. So again, finding the right resources also becomes difficult. So these were some difficult, things in residency, but of course, there are so many good points about residency, psychiatry residency as well. So let's discuss them as well. Now, it's a good branch to pursue, and of course, since it's a branch you are interested in, it's a good feeling to be in psychiatry as a resident. Now, also psychiatry is one of those branch which will give you a taste of both clinical aspect. So you have patient doctor interaction, so you will get this taste of clinical aspect, and also it is a branch which will also give you good academic aspects as well. So in the end, it's a satisfying branch as you get equally a good taste of clinical as well as academic aspect. And also, as we all know, it's a branch with a widening scope, and as we know that mental health professionals need, and mental health crisis, as we are seeing, is increasing, and there is a widening scope, and there is a good requirement of mental health professional both in India and across the globe. So these were some important facts which we've discussed about the residency. Now let's talk about the strategy. So we'll briefly discuss different strategies for first year, second year, and third year. And of course, we have so many resources. We have books, there are guidelines, there are articles, then there are departmental presentations, so many resources. So we'll talk about some of the important resources which you can utilize in your residency. Now let's talk about the first year. Now first year is a very crucial phase of your life. So plan well. A good plan will help you, do the things in a better way. So first and very important are the practical skills. Now practical skills are very important. The interviewing skills, history taking, mental status examination, these are very important. So focus on them in your first year and try to get a hold of it from the very beginning. What we have seen is, what we learn in the initial phase of our life, this basically reflects in our careers ahead. So what we learn initially is how we are going to do things most of the time in future. So it's very good to do these things correctly, and that will take you a long way. Now second is thesis. Now thesis is again a very important part of your residency, and in fact I would suggest try to spend a good amount of time in the initial building of the thesis. The protocol presentation, take it very seriously, and try to know everything what you're doing in the thesis, so that once you've done that, later part of thesis becomes a bit easy. So again, spend a good time when you're preparing the protocol of your thesis. Also, reading is a must in psychiatry. So try to get into the habit of reading from the very beginning. Try to spend at least half an hour a day reading, if not more than that, so that you get into that habit and you're able to read and sit for some time and read various topics of psychiatry. Now let's talk about the second year. Second year is a bit more relaxing for you, as now there are juniors in the department, but make the most of second year. So second year becomes an important phase as well. Since you have got the hold of the branch, you've done the first year, so now you have a bit of hold of psychiatry. So try to improve the knowledge, try to read more things in detail what you have not read in your first year. So try to build upon the concept and get the advantage of using the first year to now sharpen your theory as well. Now also, those who are interested in research, this is one of the best time to explore research. In fact, personally I would say that every resident in psychiatry should show some interest in research, be it case studies, or be it any case report you want to publish, or be it any presentation you want to do in various conferences. Try to explore your interest, and again, research done in your post-graduation day will be very helpful. Right now we may not understand, but may be very helpful in the future as well. So try to have some interest and see if you find it interesting. You can explore research more, especially in your second year. Now let's come to the third year. Now the third year, or the EGPGs, what we say, exam going PGs. Now here the focus shifts. It is more of a tunnel vision focus, wherein you have your focus of examination. That there are examinations which you need to clear. you have to clear the theory as well as practical. So again, it is important, of course. So one should focus on exams as well. University papers again become very important, and they are very handy, especially when you are giving the theory paper. So get hold of the university past paper, so that you get an idea what kind of questions are being asked. Now we also need to learn how to present a written answer. So how to write a short question, a long question, again becomes very important. And of course, clinical skills simultaneously, one should keep on refining, keep on tuning these clinical skills. These are very important both for your practicals and of course even for the life ahead after the residency. So also don't shift the focus from clinical skills as well. So theory becomes important, but in the same time keep on finishing, fine tuning your clinical skills as well, and see if there is any lacuna. Try to get over it and try to improve your skills. Now also, this is this year when you also try to identify what are your future plans, whether you want to from where you want to do senior residency, whether your shift is towards government or towards private practice. Are you interested in super specialities, or are you interested in fellowship? So also try to explore some of these future plans, and this is the right time to explore that as well. And ultimately the aim is that we learn well, so that we can help our patients in the future as well. So these are some strategies which one can follow during the residency years. Now let's talk about what are the important resources which you can utilize in your residency. Now let's start with the first year. The first year, one very important resource which you should have with yourself is these classification. So we have ICD, so latest is ICD 10, and again in some institute we still have ICD 10, so ICD as well as DSM 5. So these are some very important go-to books. So in your first year residency, carry them all the time. So in our residency days, we would carry with us all the time these classification. So whenever you are seeing any case, whenever you are writing any case, just open up, see those disorders, read important points. So you'll find a lot of important information, including the diagnostic criteria. Also focus on the duration. Again, you may find some differences in ICD and DSM. So also you should know the important differences in a particular diagnosis in both these books. And also do read about, focus on the specifiers which are mentioned. Again, there are some points of difference between these two, as ICD is more of a paragraph based book, while in DSM you will have a lot of points. So again, see the important differences as well, but carry with you. And in fact, now we have Kaplan and Sadok synopsis. So if you read the Kaplan and Sadok latest synopsis, you will also find that they have also compared various disorders. When they write the criteria, they've compared DSM with ICD 11. So again, you can have a quick idea. So when you've read that, you can also go back to synopsis and just see the important points or differences. So this is one very important resource which you should have in your first year. Now let's come to second, that is for psychopathology. Now it's very important to understand the symptoms in psychiatry. And there are two important resources which are usually used in residency. One is the FISH, clinical psychopathology, and other is SIMS, symptoms in the mind. In many of the institute, FISH is followed. So of course you should read a FISH, and as well as SIMS you can use. Sometimes for a better understanding, you can read that topic in SIMS as well. Now some of the important topics which you should have a good grip on in the psychopathology from these resources include thought. So thought is a very important topic which you will find them in this book. And also then there is a perception, then consciousness, emotion, and also there are motor disorders. So these are some very important topics which one should read from these. And very important point is definitions. Now in psychiatry, especially in your residency, you should be very thorough with some of the important definitions. So definitions you will find in these books. So definitions are very important, which you will find, and these are good books to quote some of the important definitions. So for psychopathology, you can follow FISH and SIMS. Now let's talk about the examination. Now again, examination is very important. One is the mental status examination, and then We also have neurological examination. So for mental status examination, one very important resource is Strub Black, and you'll find some important points of the MSc, as well as you'll also see some of the important tests which are done, such as for cognitive functions, which you will find in Strub Black. So it's again a good book to follow. And for neurological examination, again very important, especially for psychiatric patient, neurological examination, for which you can follow Bicasta. Now, of course, what is being followed in your institute, the performa or the ways, again, that also is very important. So also try to see that as well and keep in mind that as well. So for examination, these are some good resources. Now let's come back to the textbook. Now, one of the very important textbook in psychiatry is CTP, Comprehensive Textbook of Psychiatry, Kaplan and Sedok. That is a very important resource. And again, when you read CTP, it's not necessary that you read from page 1 to the last page. Again, one should at least read some of the important topics first from CTP, including schizophrenia. Schizophrenia is a very important topic which you should read from CTP. Then another is mood disorder, again an important topic. The basic sciences, the initial few chapters which you will read from CTP are also very important, such as neuroanatomy, neurotransmitters. Again, these are important topics to be read from CTP. Then you can also read anxiety disorders as well as neurocognitive disorders. These are some important topics which one should read from CTP. Then again, there are certain other topics which you should also read, and you can read from CTP as well. And of course, we'll also discuss some other resources. So topics such as substance use disorders, child psychiatry, again can be read from CTP as well. Then emergencies, and also psychopharmacology. Psychopharmacology is also a topic which is given well in CTP. And some of the other topics such as anxiety disorders, psychosomatic disorders also can be read from CTP. But at least in your residency, try to get a good hold of some of these topics, so that you are clear with some of the important topics, and you also started reading CTP. So again, you will get a good pace when you start reading CTP from the beginning. Now, coming to psychopharmacology. Psychopharmacology again is a very important topic, and one of the good books to read it from is Stahl's Essential Psychopharmacology. Now, in Stahl's Essential Psychopharmacology, you will find good information, especially with the neurobiology of various disorders. So again, very important. So you can read topics such as psychosis, mood disorders, such as dementia, then ADHD, and there are so many other topics, very important topics given beautifully in Stahl's Essential Psychopharmacology. Now, good point about Stahl's Essential Psychopharmacology is that they are very beautifully shown diagrams and illustrations. So diagrams again are very important, and sometimes it becomes very easy to understand things when you are seeing those diagrams. So try to start reading Stahl's Psychopharmacology as well, and some of the important topics. Now also, one other book which you can use is the Prescriber's Guide. That is Stahl's Prescriber Guide. So any patient you are dealing with, so any consultant in your institute has started any drug which is new for you, so go and just read about that drug from this book. So you will find good guidelines how to prescribe a drug. So for example, clonidine is started, go and read about it. What are the indications, what is the dosage, how one should titrate, when one should stop, what are the side effects, and certain other important points. So in just 2-3 pages, you will find some very good essential clinical information about that drug. And over the course of time, if you just keep on reading them when you are using those drugs in the patient, you will find that ultimately you are getting knowledge, good information about that drug. And subsequently, in the later period of your career, it will be very useful. So again, you can keep this book as well as with you. Now coming to psychology. Now psychology is one topic which is one of the topic which gets neglected in residency. Many times we start reading in the later part of the residency when we find that it is important, because these are the topics which are also asked in theoretical exams. So why not to start them in the first year as well. So try to first fix a resource which you're going to read in your residency. So there are numerous resources, such as there is Introduction to Psychology by Morgan and King, then there is Psychology by Barron, then there is also Atkinson and Hillgrad, Introduction to Psychology. So you can choose, just see, these are good books. And some of the important topics which one should focus on initially includes emotions, motivation, then frustration, there is stress, personality, learning theories, then there are various projective tests, and then there are various personalities, such as there is Freud, there is Jean Piaget, there is Erik Erikson. So these are some important topics which you can read from psychology. And again, when you're reading, try to understand those topics and try to make notes as well. Now let's talk about the second year and third year. Now in second year and third year, you have to add on to the knowledge, and you have to expand your arenas of reading and understanding various other concepts as well. So a lot of topics, such as various other topics of adult psychiatry, child psychiatry, de-addiction psychiatry, forensic, community, neuropsychiatry, CL psychiatry, and various guidelines also. So one should focus on that as well. So now let's discuss some of the other resources which we can use in some of the specific areas. So coming to the adult psychiatry, again, we have CTP at the hindsight, we have that. So any topic you're reading, just, you can go through that topic. Some of the important topics we've already discussed. Then there are certain other books, such as Synopsis, Kaplan and Sedok Synopsis. Then there are other resources, such as shorter Oxford textbook of psychiatry. Then there is also Tasman. Tasman again is a bigger textbook, and sometimes certain topics which you find difficult, or you want to read more, you can follow Tasman. But out of these books, at least finish one of the book from cover to cover, preferably if you can. Again, Synopsis is a good book, so try to finish this in your residency and try to read it multiple times, because if you have read this, so you have covered nearly all the important topics in psychiatry. So try to have a good sense of these resources, so that it can be used in the exams as well. Now let's talk about child psychiatry. Now child psychiatry again is very important. Often we read less about it in some of the hospitals. There may be less exposure of child cases, but again, one should have a good knowledge about child psychiatry. So of course, Kaplan and Sedok CTP is one very important resource, and one other resource which you can utilize, especially for child psychiatry, is Rutter's Child and Adolescent Psychiatry. Now when you read it, it is a bit differently given. Now what they've done is, in Rutter's, is that they have separately mentioned various topics. So you'll find topics such as developmental psychiatry. Then you will find topics such as neurobiology. So they have separately given these topics, and then subsequently described various disorders under it. Then you will find topics such as epidemiology, then clinical syndromes. So what you can do is, any topic which you are reading, suppose you're reading ADHD, so you can just go through some of the important headings related with ADHD, so that you get a good idea. And also, some of the important data given in Rutter's may be very handy, especially when you are preparing for various entrance exam, DM entrance exam. So again, this is one of the good books which you can follow. And of course, you have classifications such as DSM-5. DSM-5 again has very well mentioned some of the important disorders in child psychiatry, and again, one can read the important criterias, the specifiers, duration from DSM as well. So these are some important resources which you can follow for child psychiatry, and of course, you can add up them with some of the important guidelines and various manuals which are there for various child psychiatry disorders. Now let's talk about de-addiction psychiatry. Now again, de-addiction psychiatry is a very important component of your residency. You'll see cases of various substance use disorders. So again, Kaplan and Sedok CTP is a good book which you can read. And another important book which you can read for de-addiction psychiatry is Lovinson and Lew's Substance Abuse. Again, a very good book, and beautifully they have described so many of the important information, be it etiology, be it management. So again, this is also one of the books. So whenever you are reading any substance, again, you can also go through this book as a reference and see some of the important information. And again, if you're preparing for various entrance exam, for example, for de-addiction, DM in de-addiction, that again this book will be very handy. Then we also have substance use disorder by National Drug De-Addiction Treatment Center, AIMS. And again, very crisply, they have mentioned some of the important topics such as tobacco, alcohol, cannabis, opioids. So again, you can go through this book as well. And also we have certain standard treatment guidelines given by Ministry of Health and Family Welfare. And again, you can utilize that as well for de-addiction psychiatry. Now, coming to forensic psychiatry, again, a very important topic. And again, one should read important topics from forensic psychiatry, such as there are laws, there are forensic assessment, then child sexual abuse. So some important topics in forensic psychiatry are very important both for your practical knowledge as well as for theory. And this book, Forensic Psychiatry in Indian Perspective, is a book which gives a good coverage of some of the important topics. In fact, I was fortunate enough to edit this book and also provided some of the flowcharts in this book. So again, this is a good book which we can follow for forensic psychiatry. Next is community psychiatry. Again, community psychiatry, various programs, topics such as stigma, community care. Then, there are so many topics which one should read for community psychiatry. One of the good books is Community Mental Health in India, a very good resource which you can use for community psychiatry. As well as, this booklet series of NIMHANS again can also be utilized. Some topics, have been given here as well, and that also can be used. Now, coming to neuropsychiatry, again, neuropsychiatry is very important, including various topics such as neurocognitive disorders. Then there are neuropsychiatric manifestations of, topics such as traumatic brain injury. Then there is epilepsy, HIV, AIDS, tumor, then topics such as headache. So these are some important topics, and others as well, which are important for neuropsychiatry. So again, CTP is a book which you can follow. Then there are also certain books corely focusing on neuropsychiatry, such as Kaufman's Clinical Neurology for Psychiatrists, and there is also Leishman's Organic Psychiatry. Again, you can choose which book suits you, and you can keep one of the books for neuropsychiatry as well. Now let's talk about the guidelines. Again, guidelines are very important, and many times one should be knowing some of the important guidelines for treatment of various disorders, so that you can justify what are the treatment you're giving, and you can tell according to which guidelines. So for guidelines, first is we have the Indian Psychiatry Society guidelines, that is the clinical practice guidelines, very important, and there are recent updates as well. So again, this is one set of guidelines which one should be thorough with. Then there is NICE guidelines. NICE are basically the UK guidelines, and one of the good books, that is Maudley's Prescribing Guidelines, which is based on the NICE guidelines. Again, will give you a good perspective of management of some of the important disorders. So again, a very good book. Very lucidly they have described these guidelines and explained some of the important treatment strategies. So this can also be followed. Then there are certain other guidelines such as the APA guidelines. Again, APA guidelines, some of them are older, and some recent ones such as for treatment of schizophrenia is there. So again, you can follow them as well. Then there are other guidelines, for example, for treatment of bipolar disorder, then for treatment of catatonia in child psychiatries. Then there are certain other guidelines as well. So guidelines again are very important, and these two again are some of the important resources, and along with this, some of the other guidelines you can read. Very important to read these guidelines. Now coming to the psychotherapy, again, having a good knowledge of various psychotherapies is very essential in your residency, and in some of the institute there are also clinical psychologists. So again, you can take their help as well. Now again, for a basic understanding, Kaplan's CTP or synopsis is one of the books which you can read, so that you have an idea, basic understanding. Now two important books for psychotherapy includes The Technique of Psychotherapy by Wolberg, and also the CBT for Psychiatric Disorders by Keith Horton. So again, you can read some of the important psychotherapies from these books. So again, try to have a good idea, at least have a basic understanding of some of the important psychotherapy techniques, and subsequently you can read some of them from these books as well. So these were some important resources. Along with this, one should also have some idea about various studies such as the IPSS study and various other studies. Then there are certain clinical trials such as Catty and Cutlass, you would read in schizophrenia. So some important famous and having a very useful impact in psychiatry, you should have a good understanding of some of the important trials. And of course there are biostats. So these are important topics which you should read in the residency. So this was about some of the important resources which you can use in the psychiatry residency. Now let me take you through to the PrepLadder Psychiatry Residency course which we have prepared for you. Now all the resources which we have discussed, we have tried to use all the important resources so that we can provide good information at one place. And let's discuss how you can utilize these resources for making your residency simpler, and what are the important features which are present in the app. So first is, we have tried to cover from the most basic of topics to the more important ones and some of the difficult topics as well. So we've tried to cover a lot of important topics. And when we are discussing one topic, we have tried that all the important information from various resources which might be available, you can find at one place. Let me give you an example. For example, when you are reading catatonia in the app, you'll find that we'll start from the basic, from the history. We'll talk about etiology, and in etiology we'll try to give all the important logical factors from various resources. Along with this, you'll also find how do we assess. So clinical assessment has also been integrated with the topic, so that various methods of assessing various signs and symptoms of catatonia are present at one place. And subsequently, we'll also talk about treatment. What are the important algorithms? What are the important guidelines for the treatment? So at one place, you will find all the important information of a topic. And also, we have tried to use some of the other resources which are specific to a topic. For example, in catatonia, a very important resource is Fink and Taylor. So we have also included some of the important information from that as well, so that at one place you have everything. Now also, we have tried to cover from the practical aspects to the theoretical aspects. So we are trying to cover all the important bases. So when you see, you'll find history taking in detail. So you'll find a video describing all the important points in history taking, as well as you'll find video related with mental status examination and what are the important points which one should know in MSc. So we've tried to cover all the important areas of assessment, and along with this, we have also tried that we can cover some of the important theoretical aspects. So again, if you see, you will read about neurotransmitters and some of the other important theoretical topics as well. So we have tried to cover both theory as well as practical in the app. Now next is integration. Now what we're trying to do is, when we are discussing one topic, we've tried to integrate it with various resources. For example, when you're reading bipolar disorder, we'll talk about various subtypes of bipolar disorder. We also try to integrate some of the information which you would read from books such as style psychopharmacology, especially related with neurobiology. So we have tried to integrate the symptom with the areas which are affecting, so that when you're reading it, you are able to understand it. And also, we have used various diagrams so that it becomes very simple for you to understand. So we have tried to integrate the information together for a topic. Now again, coming to topics such as substance use disorder. So again, what we have done is we have tried to use some of the important resources such as CTP, Stahl's Essential Psychopharmacology, Lovinson and Hughes, to cover some of the important topics. So at one place, you will find, for example, etiology together. So all the important etiological information. Then you'll also find neurobiology with diagrams so that you can understand. And also, we've talked about all the important recent guidelines as well, so that at one place you have an integrated topic together. So again, when you're reading them again from the textbook, it becomes very easy. So we're trying to simplify things in the app. Now again, coming to child psychiatry, again we have tried to use resources such as CTP, Stahl's Psychopharmacology, and also used Rutters as well. So again, you'll find an integration of the etiology, neurobiology. You'll find integration, and how it is assessed, that has also been used, including how we do it in Indian population. Along with this, some of the important guidelines, for example, for ADHD, what are the recent guidelines? So that also we have included, so that at one place you're able to read the topic thoroughly. Now, what are the other important things which you'll find in the app? Now, when we are explaining any topic, you'll find that we have explained it in various headings. Starting from history, we'll talk about epidemiology, we'll talk about etiology, and again in etiology, we've talked about various subheadings. Clinical features, we've talked about the diagnosis, clinical features, both diagnostic criteria, both according to ICD as well as according to DSM-5. Then we talked about the course, prognosis, some of the important differential diagnosis, treatment, be it pharmacological, be it non-pharmacological, including the guidelines of a respective disorder. So you'll find that everything is systematized. So when you're reading, you will get into the habit of writing things in headings. And in fact, you'll find it to be very useful when you're giving your final exams. So you will get an idea of how to write a exam question, and simultaneously you'll also get to organize how a topic should be organized. So we have tried to simplify things with the use of these headings. Now also some of the other features you will find is that most of the notes you'll see that they're handwritten. We have tried to simplify them so that you can replicate when you're writing a theory question. Also you'll find a lot of diagrams. So diagrams, flowcharts will be one of the very key features of the app, of the lectures. You will find them. Now also we have used some very interesting mnemonics. So we have made, and these are mnemonics made by myself. So I've made some mnemonics, some fun ways to remember some of the topics in psychiatry, so that for example, when you're reading psychosocial stages of development by Eric Erikson, or you're reading stages of cognitive development by Jean Piaget, or when you're reading topics such as emotion or theories of motivation, you'll find some useful crisp mnemonics, so that not only just for your exams you will remember them, but even after that, maybe for life, you'll remember that topic. So we've tried to simplify things with the use of these mnemonics and fun ways. So again, this is one of the topics which you'll find very handy in your exam. Now, coming to recent updates, what we have done is that some of the important updates we have added with the topics, and any new update comes, we have provided separately. For example, last year, in 2023, there were around 5 new drugs which were approved by the FDA in psychiatry. So again, we'll add some important updates so that you are also updated about all the important changes which are occurring in psychiatry. Now let's talk about how this app is going to be useful for you. Now, as we know that sometimes seeing the voluminous books, or the so-called difficult books, we are in a fear of even starting the topic. So we have tried to simplify the topic so that that fear of reading from some of the standard textbook goes away. And because there is no replacement of standard textbook, so that you get into the habit of reading them, and things become very simple for you in your residency. Also, you can use this app as your go-to study partner to understand concept, and also, as I discussed, remembering things. So we've not just given you concept, we have also tried to give you ways so that you can remember, and you don't have to waste time in remembering things, because once you use those mnemonics, fun ways, it becomes very easy to remember. Also, you'll find in the app that we have tried to provide you content paper wise. Many times when you come to the third year, you start understanding how the papers are. There are 4 papers and different topics. So what we've done is, from the beginning you'll get an idea that this is how the final year exam is going to be, and so that you get an idea what are the important topics. And simultaneously, when you're reading it, be it in your first year, second year, or even third year, you are getting prepared for the exam as well. So that is what we have done. And not only theoretical skills, as I've discussed, we have also tried to add some important topics related with clinical skills, so that you're not lagging in either of these. So these are some important points. Now, we are very happy and really excited to be part of your residency journey, and we feel thrilled to be a part of it. Now the main and sole purpose is to make things simpler and easier for you, so that your residency journey goes smoothly without a lot of hiccups and bumpy roads. Now, learning is an ongoing process. We'll be keep on updating, adding more and more content, so that we can help you out more and more in your residency. Now, let me talk about some of the other assets which are there in the PrepLadder Psychiatry Residency course. We'll be adding soon the Q Bank. So you'll be getting a lot of questions which will help you assess yourself, and these will be very helpful for active recall as well. And also, if you're planning for any fellowship, you're planning for any super specialty, or even for SRship, nowadays there are MCQ based exams, so this will again come handy for that as well. Now we'll be also soon adding notes, so that you get notes for understanding the concept and also remembering, and also treasures will be added for some of the important topics. So friend, this was about the orientation and a quick guide for your residency. And again, we are very happy and thrilled to be part of your journey. And may God bless you. Do rise and shine in your residency, and all the very best for the future. Thank you, everyone.